This morning, outbound Eisenhower traffic's heavy from Houma to Independence. Crash is cleared out of the left lanes. We're now just seeing residual congestion. Expect some congestion on the exit to Central as well. There's closure of Harrison in Central and Lotus. This is due to the coronavirus testing at Loretto Hospital, which gets underway in a little bit this morning. In Darien, Cass Avenue is still closed between I-55 and 75th with downed power lines. Farther south on I-55, it is a slow go through the work zone with delays from Lorenzo Road to Blodgett, with the wet roads factoring into that single-lane construction delay. That's traffic. I'm Jim Talamonte on AM 560 The Answer.
Chicago's Morning Answer continues next in our 1-hour heating and air conditioning weather center. A cooler day ahead, rain and drizzle, breezy this afternoon, high waves on the lake, I-55. 54 right now. Next news coming up at 9. Breaking news as it happens. Chicago's Morning Answer with Dan and Amy continues next on AM 560, The Answer.
This hourly segment is brought to you by Papa Nicholas Coffee. Papa Nicholas, great coffee, period.
When you've got questions, he always has an answer. It's Sean Hannity this afternoon at 2 on AM 560, The Answer.
Top of the morning, Dan and Amy. There is some optimistic news to report about, cleansers as well as a vaccine. On the vaccine front, you've heard from Mike Scott.
Oh, yeah, about the monkeys.
Oxford University jumping ahead of the pack. Human testing already underway. They're hopeful for a COVID-19 vaccine to be widely available by September.
And the reason why they're so optimistic, they've been working on a COVID vaccine for the last 10 years. So that's why they have a little information about, because there's different strains of it. So that's why they're so advanced and so ahead of any other organization right now.
Sarah Gilbert, the professor of vaccinology at Oxford. I have a high degree of confidence about the vaccine because it's technology I've used before. As was mentioned, the vaccine has reportedly worked in protecting rhesus monkeys. Human trials, 550 participants given the vaccine, 550 receive a placebo. And based on the initial optimism, a drug maker in India is going to start producing millions of the Oxford vaccines by next month, even before they've been proven to work. So you're ready to go if it does check out. In addition to that, Hong Kong researchers have announced this spray called MAP 1, which supposedly disinfects surfaces, the disinfectant lasting for up to 90 days. And again, something that's been worked on for the better part of a decade, ever since the SARS outbreak. They've been working on this spray for the purpose of disinfecting, and they claim to have a disinfectant that has that kind of staying power, so that would be very popular as well for obvious reasons.
I remember we had Mike Lindell on yesterday from the CEO of MyPillow. They have a disinfectant spray that he's using that lasts 60 days, so 90 days, I guess, is better too.
Let's talk a little bit about antibody testing. Again, I keep saying this. This is my mantra, which is the way we get back, particularly in states that have terrible political leadership, like, I don't know, say Illinois, is through medical professionals and public health professionals and scientists leading the way, debunking the a-science or anti-science mysticism of politicians. To help us do that with respect to antibody testing, we're pleased to be joined by Dr.Rinku Shah and Dr.Manan Trivedi from the Clear Wellness Group. Doctors, thanks for joining us. Appreciate it.
Of course. Thank you so much for having us here.
Tell us what you folks are doing on the matter of antibody testing.
Yeah, 100%. So we're actually having people come in, getting their blood tested, sending it off to Abbott Laboratories. And what we're doing is we're checking for the IgG antibody to see, did they mount an immune response to the novel coronavirus? And everyone keeps asking me, why does this help? Well, honestly, it helps us get more information. We need more data. We know we weren't testing people in January, February. We weren't testing enough people in March. This gives us a much better idea of how far did COVID-19 get.
And then are you reporting your results to the Illinois Health Department?
We are. So, in conjunction with Abbott Laboratories and Quest Diagnostics, they're compiling this information that, we send over to them, and then they will be sending it over to them.
Now, you're Chicago-based. I want to just make that point too, because what we're hearing from the governor when he's queried about the results of antibody testing in Illinois so far, as we've heard from some studies that have been done in California, in New York, in France, um, uh, we're hearing from him rather than giving us the initial results, even if the studies haven't been peer-reviewed, the tests verified that it's too soon because they're still checking the accuracy of the tests. They're still putting the data together. Is that a reasonable response to that question, or is there antibody information that should be made publicly available at this juncture in Illinois?
You know, honestly, we're doing the best we can with the research we have. We chose Abbott Laboratories. They did get the emergency use authorization by the FDA. I think people want answers. I think people want information. I think it's best to get this antibody test out there, getting people tested, informing them, the pros, the cons of it. But, we've been lacking. Like, we really have not been testing enough, and people are frustrated that they don't have information. They want to know that cold or flu, whatever they thought they had in February, March, and April, what was it? So, we're definitely backing Abbott here. We looked at the data ourselves. Sensitivity, specificity of this test is 99.5% and 100% in clinical trials. And so we're saying, we got to go with the information we have. We're going to trust a really reputable lab and really get more information in the hands of people so we can do something with this information now.
Right. And then the more people that would have it, the lower the lethality rate, correct? I mean, we need to know who's had it and who's been exposed to it.
Yeah, it's 100%, and it's really important to our at-risk population. I mean, I've got parents who are elderly, and, if their antibody tests are coming back negative, like, I got to say, hey, you got to stay home for a little bit longer until we really figure out more news about, immunity and this vaccine that might be coming out in September. Not to say that, if you get a positive result that it means immunity. We just have so much more research to do. But it gets us something, gives us a little bit of peace of mind, and that's all people are looking for right now.
Well,
And also too on that score, I mean, we do have some research on animals. Dr. Osterholm from Minnesota, University of Minnesota, reported that over the weekend. That is pretty encouraging about a developed immunity from antibodies, at least seasonal.
No, and I completely agree. I mean, I'm to be cautious. I don't want people to stop social distancing and taking off their masks. I mean, I'm very optimistic that this could mean a significant amount of people will be immune. We're obviously not saying, to that 100% degree, but it's something. I mean, especially for our healthcare professionals, they're going out there, our first responders. It gives them more peace of mind saying, hey, if I've had this, I fought this, the likelihood that I won't get it again this season is pretty high. I'm going to feel a lot better about going into the workforce and then not being scared every day to what am I bringing home to my families.
Is there a prioritization to the antibody testing that you're doing?
We are allowing any first responder, anyone in healthcare, if they call our clinic, they will get in that day. This antibody test is open to anyone and everyone. We're just saying that if you are on the front line, please call our clinic. I'm giving out my cell phone number. I'm like, if you want to get tested, we will figure out a way.
Well, can you give people a number or website right now? Because I know a lot of people are interested in this.
They can give us a call at 312-535-5770 or book at our website directly at www.clearwellnessgroup.com. But by all means, you can even text this line that I just gave you. We will figure out a way to get people in.
I both medical doctors to wade into political discussion understand to be true about this and about a science-based approach to this thing, and also contemplating secondary effects, which we're just starting to have more central in our larger conversation about combating the spread of the virus. Does it make sense for particularly young people not to forget even work for a second, not to be allowed in parks or engage in physical activity? Basketball courts, tennis, golf, where you can stay pretty far apart, the sort of sports and activities where social distancing guidelines are very easy to follow. Does that make sense to you?
To allow them to go back to it, I actually don't think so. I mean, the studies that I'm getting, I don't think we've got a good enough herd immunity in an ideal world, I mean, if people were going to stay so strict, if they want to play golf, sure. I just don't. I think if we start to lessen now, it could actually be detrimental. I mean, I don't know how you play basketball with staying 6 feet, like 6 feet apart.
Shoot
I think
hoops and whatnot. Yeah.
I mean, my goal is, if we can get people into parks and things like that, and we can assure that they're going to keep that level of social distancing, wonderful. I'm just afraid that everyone might not abide by the laws if we open up.
Well, I know, but here's the thing. At some point, no matter what you hope is true, you're going to have to trust people, right? I mean, you trust your patients, even though sometimes they don't do exactly what you say they should do, and so on. I mean, at some point, you can't get around the fact that there's going to have to be trust placed in people to look out for their own best interests in the same way that they otherwise look out for their own best interests as a matter of course in their daily lives.
No, you're definitely right on that. And I think, hopefully once we get through the shelter in place in May and in June, we can hopefully lessen some of these restrictions and, play it out. See, hey, we're doing exactly what you said, putting trust back into these people, and give it a trial run and say, hey, what's happening? We put people out there. We're still telling them to follow restrictions. Are the numbers going up? Are they still leveling out? Are we still flattening the curve? And if that remains the case, then I mean, we can do a trial and say, let's see if this works. I'm all about it. I've got 2 kids at home. I want to get to the park.
Yeah, there you go.
Now, if you come back with a positive, antibody test, does that mean that everybody in your family has it as well, or should they get tested too?
No, they should get tested. I mean, we really want to know, I stand behind Abbott in this test, but I have had a family where I had a positive result in one and a negative in the other. And it's just interesting to note in the data that we use with that. So, hey, did that person really not get infected, or did they get infected and they just not mount this IgG antibody response? So I do think it's important, at least for, adults to get tested, and both members of the family, if not the kids as well.
Now, as I understand, you're an anesthesiologist. Is that right?
My husband, he's right here, Dr. Trivedi.
Oh, he's an anesthesiologist. Okay. I was just trying to get your disciplines. And Dr. Shah, what's your particular area?
I do primary care, so traditional family medicine.
So what I wanted to ask you both is just COVID-19, and I understand what you're doing with the antibody testing, which is great. But with your respective disciplines within the medical profession, what are you seeing in terms of your normal patient load for the treatments you provide? What are you seeing now versus your normal patient loads for the treatments that you provide, I should say?
You mean like outside of COVID testing?
Right.
Yeah. Are you doing anything else?
Yeah. So actually, we're doing a lot of mental health. I mean, we just did a segment yesterday on this, and I mean, it's what is COVID causing, and it's not just all these illnesses, but mental health is like at the forefront of this. I mean, people with depression, anxiety, PTSD, and now, they're staying home. They're not having access to their therapist, to their friends, to their support group. I'm getting calls with like 10 to 20 calls a day of, my anxiety is worsening. What do I do? How can you help me? So, I mean, minus the antibody testing, it's mental health. And we really, really need to start recognizing this and seeing how we help these people. And, that kind of brings me to Manan, and I'll let you say a little bit about what he does. But he definitely is anesthesiologist and pain management, has a major health focus right now, mental health focus.
Yeah, so we opened our clinic basically with a significant focus on mental health, and we've been offering ketamine infusion treatments for those suffering from treatment-resistant depression, anxiety, PTSD, and it's been surprisingly effective over the past few years. But we're definitely seeing a large uptick in patients concerned about either their jobs or finances or just the overall uncertainty in the world. And we're happy to help however we can, either with, infusions from my end or seeing Dr. Shah and working through it on that end as well.
Yeah, I do a lot of telemedicine with anxiety, depression, PTSD. I'm seeing them, figuring out what the best treatment options are, putting them in touch with therapists who are doing telehealth, and then just kind of devising a better treatment plan for these individuals.
Well, do you think that the media and that our government in certain states or governors have scared us to this frenzy, into it?
I mean, to a certain extent, yeah. I mean, my patients will come in and they're like, I no longer want to turn on the news. I just can't do it anymore. like everything they're seeing, I mean, there's not a lot of positive they're hearing. They're hearing so much negative and, so much misinformation that people are just like, please don't give me any more news. I can't handle it anymore.
Well, that's why they need the balance. This is a show that promotes good mental health. They need the balance of this program. So please turn them on to our program. They are Dr. Rinku Shah and Dr. Manan Trivedi, the Clear Wellness Group in Chicago. And again, that website, clearwellnessgroup.com, clearwellnessgroup.com. They're offering free, they're offering antibody testing, I shouldn't say. I spoke before you, offering antibody testing, and then, of course, their regular retinue of services. Doctors, thanks so much for joining us. Appreciate it.
Thank you
so much for having us.
Thank you so much, both of you.
Thank you. And Dan, I got my test on Sunday.
For the mental health test?
No,
how'd it turn out?
For the antibody test. And the results should be in on Friday. But also on my intake form, they asked me if I wanted information about Botox and fillers.
And then what about the mental health piece?
That was a part of it too. Do you need help? And somebody called me from there yesterday, so I think it's a great thing that they're doing.
Very good.
And they joined us on our turnkey.pro answer line.
Connect with Dan and Amy using the AM 560 mobile app. Download it today at 560theanswer.com/mobile.
We live in a world driven by information where we hear about data privacy concerns and high-profile data breaches nearly every week. Organizations constantly face new information governance obligations like GDPR and the California Consumer Privacy Act. Take control of your documents and data with Governance Rules as a Service from IDT and Highland on Base. Now, with the help of IDT and Highland on Base, you can achieve both compliance and peace of mind by subscribing to the industry's leading retention, privacy, and data compliance platform.